All, this is Dr. Mubin Sayed. Welcome to one more show. Let us start our best day of the week, and that is one-on-one. That is our questions answered. So let's start. So what I'm going to do is, once again, I'm going to look at the Twitter side where people had been, Cool Beans had been posting their questions, and then I'm also going to mix in the questions from the live stream as well. Please, when you have a question, place the letter Q or question so I can scroll through the comments and find the questions. So let's start. So hopefully everybody is doing good. James, welcome. Hello. Hoctus protocol. Good evening. Good evening. Welcome. Good morning. Good evening. Quite a day. Yes, quite a day. We're going to talk about it. Luffy. So Luffy is somewhere sleeping today. So welcome, everyone. Let's start our discussion. So first of all, I'm going to start with from here. So the first thing I want to do is to thank Margaret McInnes. She has once again donated generously, and she has been doing it. She has been donating and supporting for 2-3 months, and very generously. That has really helped while we are continuing to focus on COVID-19 lectures. So in my opinion, these lectures are now brought to you by Dr. Mubin Sayed and by Margaret McInnes as well, with the way she has been supporting. So thank you, Margaret McInnes. Secondly, Trump. So of course, we are all aware of the news. I hope that he stays healthy, he recovers quickly and gets back to his work. And that is my same prayer for everyone. This is a difficult time for all of us who are exposed to the virus or who have been suffering from the virus or who have lost people from this virus. It is an evil time. It's a bad time. And the situation is the same for every human being. So my thoughts and prayers for everyone. And I think you are aware, all of us have been working to figure out ways to protect ourselves, our loved ones, and humanity in general for months now. So it's not just the words that we have here, there are actions here as well. What is interesting for me is that I had tweeted to Trump that hydroxychloroquine, ivermectin, zinc, quercetin, vitamin C, vitamin D, and a number of other vitamins, I had suggested those. They have taken the Regeneron's polyclonal antibodies or the cocktail. We actually talked about it a couple of days ago. In the Bromelain video, the second part of the video was the antibody cocktail. And I hope you remember that the benefit of that cocktail is that there are two types of antibodies. So the monoclonal antibodies usually will bind only to one part of the spike protein, and the polyclonal antibodies, or cocktail as they're calling it, they would attach, there'll be multiple kind of antibodies that might bind on various parts of the spike protein. So for the virus to escape them is difficult. So to give you a simple example, imagine there are police dogs, correct? So they ask them to go and catch a criminal. So imagine the criminal here is a spike protein and the dog is the monoclonal antibody. So if there are more than one dogs, they might catch the spike protein at various places, and it would become difficult for the spike protein to run away or to function. So that is the cocktail, and they have given him that cocktail. So once again, I hope that then this becomes available to others as well. And then another important thing to keep in mind, and that is true for all of us, the disease has two phases. One phase is the viral phase. And in the viral phase, antivirals or viral neutralizing agents are useful. So antivirals, or for example, antibodies, convalescent plasma, all of these things are useful at the antiviral phase. When the phase start transitioning towards immune dysregulation, and the sign of that is the breathing difficulty and oxygen saturation dropping, that is when it is important to start using steroids and then drugs like leronlimab or other modulators. So that is how this has to be looked at for every patient. And so I think it would be the similar thing. I was pleasantly surprised that they already had given him that cocktail. That means whoever are the medical professionals around Trump, they are keeping aware of the latest that is available. That surprised me further as well, that this information has not trickled down to CDCs or FDAs or other administrations for them to say, please push these things further for the remaining citizens as well. And now we are sitting here looking at Tylenols and cough syrups, while the healthcare professionals at the highest levels are aware of the techniques and methods that are latest and more reliable and more promising. So that kind of made me a little upset. But generally, I was pleasantly surprised that they are aware of the cocktail and they were working on it. I was proud as well that we talked about it a couple of days ago. So with this, of course, wishing Trump and Melania all the best, great health, quicker progress back to the normal. Same for everyone as well. So with this, so once again, thank you to Margaret. Secondly, wishing good to Trump, and I like the protocol that they've used. It was kind of interesting. Remember, Trump had said once before that he had used hydroxychloroquine. Interestingly, this time, they did not use hydroxychloroquine, or at least didn't say it, or ivermectin. So I think there is some opinion in the medical professions around him. So they have done whatever they thought was the best for him. So with this, let's continue. So what I'll do is I'll bounce between the two threads. So I'm going to start with the Twitter part. So first of all, so again, here is the tweet that I had done, and these are the questions. I'm going to go from the bottom up because the bottom side of the questions are the first one that came in. So thank you for your help, doctor. So excellent. Welcome. A very good Italian scientist named Enrico Bucci told quercetin is useless because of its low bioavailability. This is a French word for bioavailability, so biodisponibility, around 2%. What do you think about this? Can the problem be fixed with the use of Quercetin Phytosome, or the critic is meaningless? So I hope that we get the question. They're saying that when quercetin is taken, the bioavailability is low. So yes, I want to show us all that the bioavailability is actually low. So here, this is and all of these links are in the description as well. So here is a study where they've talked about the bioavailability of quercetin, and what they have talked about is the following thing. Quercetin, when it comes from foods, it may have a glucose attached to it, right? So imagine there is a quercetin molecule. Imagine this, my drawing pens holder. Imagine this is quercetin. In onions, red onions, quercetin has an attachment of glucose with it. On the other hand, in apples or grapes or other things, quercetin molecule does not have glucose attached to it. So what happens is when glucose is attached with the quercetin, then the benefit is that in our GIT, in our gut, so let's say this is our gut. In the gut, we have, of course, cells, and on the surfaces of the cell that are facing the gut's lumen where the food is present, on those surfaces, there are channels or transporters that pick up the nutrients and push them into the cell, and then these nutrients come out of the cell and go in the blood system. This is the absorption's mechanism. Now, many nutrients would simply diffuse through this and then continue on towards the blood. So those nutrients that just are diffusing, they find it difficult to become absorbed, and it takes longer for them to be absorbed. On the other hand, there are certain other nutrients that our body needs a lot, and what body does is that it uses energy channels. It uses energy to kind of pump them. So what is the difference between them? Imagine a boat on the river which does not have any motors attached to it, versus another boat that has a motor attached with it, which would use energy. So imagine that this is a channel that uses energy to actively pull substances from the lumen of the gut and then move them into the blood. So interestingly, when quercetin alone is taken, then it has to diffuse through the system. So it takes time to become available. And the time is 2 to 4 hours, and then 6 to 8 hours. So there are two peaks that appear. On the other hand, if quercetin is attached with glucose, so imagine if this is the quercetin molecule and this has a glucose attached with it, the glucose itself, our body picks up glucose from the gut in an active manner because it's a precious thing for us. It is the money to run our body. So because glucose is precious and because our body has transporters that have energy to use glucose, to pull glucose, then whatever is attached to glucose would also be pulled. So quercetin, which is glycated, which has glucose attached to it, that quercetin gets absorbed fast. Within 40 minutes, it becomes available in blood. On the other hand, the quercetin that is just given as a supplement may take 2 to 4 hours to become available. So this is the basic difference. And now the glycated quercetin is it is present in onions. On the other hand, apple's quercetin does not have glycation, or grapes quercetin does not have glycation. Similarly, the quercetin that we buy from in the supplements, these are of two types as well. There are quercetins that are simple, and then there are quercetin, as the question asker had said, Quercetin Phytosome. And once again, I have no interest with Phytosome. I have nothing to do with them. That is a commercial product though. And that Quercetin Phytosome also becomes available within 30-40 minutes. So that means if you're trying to take quercetin, what is the best way of taking quercetin, or what are the best molecules for it? So red onion would give you the best molecule, or Quercetin Phytosome are going to give you the best molecule. Number one. Number two, when the quercetin is absorbed in the blood, normally only 1.6% to 2% of the quercetin becomes available in the blood. The rest of the quercetin is just used up or metabolized. Now, is that a bad thing? Not really, because we take, let's say, about 500 milligram quercetin daily. Let's say we take it through the oral route, then 2% of that becomes available, and that is possibly good for us. On the other hand, if you're taking Quercetin Phytosome, that has a 20 times higher availability. So if you're taking Phytosome, and if you took 500 milligram, for example, then you're going to end up having 100 milligram of quercetin entering the blood. On the other hand, if you're taking normal quercetin and that you've taken 500 milligram, only 10 milligram would enter the blood. So there is a 20 times difference. However, there has been no side effect of this additional 20x amount of quercetin. So I think, of course, Phytosome is better. Then there is a few questions around quercetin that I want to just quickly handle them right here. That is, so if you see here, the quercetin has side effects. So somebody had asked that what are the side effects? So normally it is pretty safe. However, the side effects of quercetin are that it can cause tingling in arms and legs, tingling sensation, and it can cause, in very high doses, kidney damage. And now how high? If it is given more than 722 milligram IV, 722 milligram IV means that is all bioavailable right away in the blood. So that 700 milligram in the blood would probably be thousands of grams of quercetin if you took orally. Remember, it's only 2% of the oral quercetin that is going to become available. So imagine to make 700 milligram available in blood, how many thousands of milligrams you would have to take orally. So it's a very high dose that can become toxic to kidney. In the normal 500 milligram twice daily, that is fine. So hopefully this makes sense. Then there is another set of questions about quercetin and hydroxychloroquine interaction, and there are no known interactions. Then there was a question about quercetin absorption. So 2 to 4 hours, quercetin is absorbed in 2 peaks. And why does that happen? Imagine if I am a cell that is picking up quercetin. So what happens is when the quercetin is administered, when we take it, the cells transporters would start working on quercetin to start picking it up, and they'll become exhausted and saturated. So then they would stop. Then they would need to become freed up again, and they'll start working again. Because of that, when quercetin is absorbed, it is absorbed in 2 peaks. So the first peak appears in 2 to 4 hours of taking quercetin. The second peak appears in 6 to 8 hours. And if you wanted to avoid that, and if you wanted to have a more streamlined availability of quercetin and immediate availability, then something called isoquercetin can be used, and that is the quercetin present in the red onions. In addition to that, one can also take Quercetin Phytosome. That becomes available fast as well, within 40 minutes. So that is the discussion on the quercetin side. So back here, is that 2% bioavailability useless? No, not at all. It is what our body uses, and we use it every day and work with it. Then over here, Moore says, following your video on 25th September about boosting the innate arm of your immune system, please explain why individuals who are suffering from type 1 diabetes, rheumatoid arthritis, MS, psoriasis, and IBD have to be careful if wanting to do the above. And I remember that I had put that little warning in there that if you have an autoimmune disease and then you're trying to boost your innate arm, that would hurt. And that could potentially hurt. So don't do this without talking with your doctor. So I'm going to explain it once again here with a diagram. So look, what happens is that, let's say this is the innate arm. And now we are all very much aware of what is in the innate arm. We have natural killer cells there. We have neutrophils there. We have macrophages there, dendritic cells, and so on, other cells here. And some proteins like complement proteins and others. Then we have the adaptive arm. An adaptive arm, again, we know it has 2 wings within it. One is a cytotoxic wing and the other is a humoral wing. We were talking about augmenting the innate arm. Now, many of the autoimmune diseases occur because of our immune system is not working correctly. And that working correctly, not working correctly, means it is more active, it is more functioning than a normal immune system. It is overreactive. So imagine if somebody has rheumatoid arthritis, or somebody has SLE, or MS, or IBD, or type 1 diabetes mellitus. All of those are examples of autoimmune diseases in which our immune system is already dysregulated. In some diseases, the innate arm is more active. In some diseases, the other part of the adaptive arms are more active, but the end result is that we have immune system that is overactive. For such immune system, if you activate it even more, it's going to become nuts, it's going to become crazy and cause damage. So normally people who have these autoimmune diseases, doctors are giving drugs like hydroxychloroquine to suppress and calm down their immune system. So imagine now somebody has autoimmune disease, they are taking medicines to suppress their immune system, and here we come and give them foods to enhance the immune system that would actually counter the medication's effect and can cause the harmful effect of autoimmune disease again. So that is why I talked about the situation. For example, over here, type 1 diabetes mellitus. Type 1 diabetes mellitus is an autoimmune disease. In this, what happens is there are antibodies. So that means adaptive arm of the immune system, humoral part. Antibodies are produced against the beta receptors, beta cells in the pancreas. And those antibodies can destroy the beta cells or those antibodies can connect with insulin molecule and destroy that, or those antibodies can connect with other molecules within the beta cell and destroy them. So in such a person, if you enhance their immune system, you might activate these cells even more. So that was the point because of which I had said that if you have any one of these diseases, please do not boost your immune system without talking with your doctor. I hope that clarifies that question. So I'm going to take one more question here and then I'll go to the live talk. So how can we stop Big Pharma? I asked a Big Pharma CEO to justify why his company raised the price of a life-saving cancer drug by over 500 per pill since it first hit the market. He couldn't answer. The same CEO made 13 million in 2017, including a $500,000 bonus for their price hike. So we are seeing this very commonly. And the basic problem is not just the Big Pharma. The basic problem is the way our healthcare system is architected. The biggest fraud in this healthcare system is the Big Pharma helping produce regulations and rules and laws that prohibit people from getting medications. And so insurance and pharma, they are all actually causing this damage. And we as American citizens, we have allowed that to happen. Our representatives are the ones who are working with these companies and making regulations to make this happen. For example, tomorrow we're going to talk about Bromelain once more with Dr. Harrison. And Dr. Harrison and I had a chat today, and he was saying that, look, we can get Bromelain and others from outside countries. But the only way to get them is to prove to our health administrations that we are importing a drug that is not available here, number one. Number two, it is life-saving. Number three, a doctor has prescribed it. Tell me this, Bromelain, and we need to prove that this is a life-saving drug. We have to prove it is not available here, and then we have to prove that a doctor has given a prescription to get that drug. So as long as this mafia continues, which Big Pharma is one part of it, but then the representatives who are working with them, and then the administrations like CDCs and FDAs, those bigger agencies that are working with them, that are in their pockets, unless we fix that situation and then with the insurance, we're not going to get out of this situation. So for me, if I was the one to make decisions, I would say, fine, you get the prescription, your insurance is still the same way for the doctor's fee, the way it is structured today. However, medication can be gotten from wherever. I understand that the basic problem would be that people are going to self-medicate, and that is going to cause an issue, and that would put a load on the insurance system. Well, here we are looking with the pandemic that people are not able to take medicines, and hundreds and thousands are dying, and millions are sick. Isn't that a burden on the healthcare system? Imagine we had steroids available. Imagine if we had ivermectin or hydroxychloroquine available. Would we still have the similar burden on the healthcare system as we are seeing today? And would we still have so many deaths? So this is a fraud that is happening. I'm sorry to say it this way. I know some people are going to yell at me now, but this is a mafia that is working. This is a fraud that is happening. And before this pandemic, less people were losing lives because of they were. Remember, insurances sometimes refuse to give drugs that are life-saving. Insurances sometimes refuse to approve procedures that are life-saving. So people were dying before as well. I think the numbers were not as prominently apparent to all of us as with this pandemic. So it is really not just the Big Pharma. And Big Pharma knows that the whole system is in their pocket. If they would raise the price, we cannot do anything. I cannot go to India and import hydroxychloroquine where I can get that. Even over here, it is dirt cheap. But imagine many drugs that are expensive here are dirt cheap outside. And I know all those messages that we have done research here and it takes money to do the research, and there is a lot of money spent on it, and then we have a right to make that money back as well. If we don't do it, it is all charity and it would not work. Fine, all that is fine, but tell me this: there has to be a reasonability in the profit, and because we are trapped, then the profits can continue to hike and we cannot do anything about it. So I think this was a Luke, Henry, this was a good question. We are stuck in this for a long time. So it is not that you and I can sit here and decide that this is how it should be and it would become fixed. This is where we are stuck. I actually want to have the medical tourism started, just like some companies have, to bring people outside of the US. Imagine for this COVID-19 issues. When people become mild and severe, the healthcare spend on them is in thousands of dollars or hundreds of thousands of dollars. And imagine if somebody spent $2,000, went outside the country, got themselves managed, and came back. So let me come to the questions here. So I'm going to start from James Kelly's question. Given your glucose comment, is quercetin taken up by the SVCT1 and SVCT2 transport channel? So SGLT1 channel is the one that is used for the glucose. This channel is used by vitamin C, glucose, and carbs. I'm guessing, therefore, that we should not take the quercetin around this time we eat sugar, carbs. So the quercetin is good to be used with lipids, because quercetin, if it is attached to lipids, is easily absorbed as well. So it can be taken, James, it can be taken with the food. Glucose transporters are ample and they are active transporters, so they can actually pick up quercetin. But if food has some fatty content in it, that would actually make normal quercetin to become better available and more absorbed more. But very good question. James, are you a doctor? So you usually have a very good technical questions. So if you're taking on an ongoing basis, the rate of absorption is less important. That is correct. If you are continuing. So if you're taking some drug on ongoing basis, then the drug's half-life is something that is important. If something is eliminated, half of it within 4 hours, and you have to keep a specific therapeutic threshold available, then the half-life should matter. So I think Doug has done the math on how much milligrams of quercetin would need to be taken orally, and then if it has 2% bioavailability to make 700 milligrams, so 35,000 units of quercetin. Okay, so M. Gregory says, question, where did the 6-foot distance value come from? So M. Gregory, that is a very interesting one. So I think somebody said 6 feet, and then they started doing it. I would simply say it this way. First, we have to agree on this, that when we are talking or coughing or sneezing or breathing or laughing or whispering or doing whatever, the particles are going to come out of our mouth. And if somebody is in the range, they're going to end up in their mouth and nose or eyes. That's one basic agreement. If you don't agree on that, for example, some people say it is not airborne or it is not transmissible through the respiratory system, then I don't have an argument further with them. But if we agree on that, then it really depends how forcefully the particles are coming out. If somebody is sneezing, it is known that a sneeze, the particles can be shot out up to 20 feet. On the other hand, if somebody is whispering, the particles may go just for a few feet. So 6 feet seems relatively okay, but really the science would have actually lesser feet or more feet depending upon how a person is behaving. On the other hand, if there is a mask available, it is possible that the mask would hinder. So even if somebody is sneezing, it would kind of cause that vapor or the particles to be dropped shorter. So maybe the distance 6 feet becomes okay. But good question. So quercetin has been nebulized, which is excellent. Question from Tiju Thomas. What about quercetin with bromelain supplement? I do not know if there is any specific formulation in there which makes it glucose attached, or which makes it phytosome attached, or which makes it lipid attached. So if that is the case, if it is lipid attached or glucose attached or phytosome attached, it would have better absorption. Autoimmune is reacting to the wrong thing and is somewhat exhausted. Okay, so that probably was not a question. Looking at the questions. How is everyone doing? So Muhammad bin Shaida says, is there a study specifying the time of exposure with a patient? CDC said 15 minutes without mask with less than 6 feet. That is a confirmed quantity of virus to be infected? So no, I have not seen any such studies. What I know is that the airborne particles in closed spaces or in circulating air spaces can stay there for hours. On the other hand, the non-airborne, that is respiratory droplets that are bigger than, let's say, 10 micrometer, can stay there within a few minutes and then they would fall. And look, it's a very simple thing. You can, I'm going to give you a gross example. If somebody has the snot coming out of them, that is going to fall right away to the floor or whatever place they have nearby. That is because it was too heavy. On the other hand, if it is a smaller particle, it's going to go a little bit farther, but it's going to fall as well. And then if it is airborne, it's going to stay there for hours. So the 15-minute rule also is an arbitrary rule. And how did that come in? Was that the very first patient in the US had stayed in the clinic for 20 minutes. And so they thought that he may have infected others because that was the time. But there is no scientific data yet to say if a person is sitting here for how many minutes, that would definitely cause enough exposure for others. And I think for ethical reasons, that kind of study cannot be done. Only observations can be done. Animal studies can be done. So Barbara says, yes, so true. Dr. You're courageous, spiritually aligned, and exceedingly intelligent. Thank you. There is a mafia. Yeah, that is true. And that is causing, these folks are causing lots of damage. All right. So I'm going to look at one more question here. Is there a study? So that is what we just talked about. I'm going to go to Twitter now. So here, interaction between ivermectin and hydroxychloroquine, no known interaction. And if I think aloud with you from a scientific point of view, medical point of view, hydroxychloroquine's bad effects are to change the pH of the cell and then to cause stress on the retina of our eye, on the heart cells, increasing the QT interval that can then cause arrhythmia, and on the blood disorders or the G6PD type deficiency RBCs, which might not be able to work with the hydroxychloroquine that successfully. On the other hand, ivermectin, the basic side effects are if it crosses the blood-brain barrier and then goes to brain and causes toxicity over there. Other than that, ivermectin has been known to cause some edema and irritation and GIT issues. So these mechanisms don't seem to be coinciding with each other. So if, for example, if ivermectin and hydroxychloroquine, they both were acting on GIT somewhere and they both are working together and enhanced each other's action, then we would have said there is an interaction. So there doesn't seem to be an interaction. Similarly, the liver enzymes and their enhancement or suppression by these drugs are also not in these dosages. They're not known to be causing effect to each other. So then there is a question here by Adam Gartner. I was told by someone today that there is some evidence that ascorbic acid worsens cytokine storm. I can't find any and wasn't given any idea what that could be about. So Adam, I actually looked up as well, because that is contrary to the normal understanding of vitamin C's function. The vitamin C's function is to actually help modulate the immune system, and it is an antioxidant. So it should not cause an enhancement of the cytokine storm. So this to me seems like a rumor. I Googled a lot to try to figure out if there is any study like that. So no, there is no such thing. And then Nek Singh says, I have a similar question. Is the over-the-counter vitamin C strip, majority of it is ascorbic acid, available generally good enough, or only and only liposomal vitamin C should be taken? So Nek, normal vitamin C is available good enough as well. However, if you take liposomal vitamin C, that would cross the cell membranes and get absorbed faster. So if you need an immediate attention, for example, when the patient is inside an emergency, over there, ideally they should just give them IV ascorbic acid. But if you want to be a little more sophisticated with the absorption, then liposomal is fine as well. There is this, I came across this article regarding platelet can associate with SARS-CoV-2 RNA and are hyperactivated in COVID-19. I actually looked at that article as well here. And what is interesting for me is I could not, so the question is from Teju P. Thomas. And Teju, what I could not find in this article or in their study is what did they mean by platelet associated with RNA? Is it that the viral RNA is inside the platelet and it is modulating the platelet, or it is influencing the platelet in some way? So there is just this one weird sentence that the RNA, viral RNA, is attached to the platelet, associated with the platelet, but there's no explanation. So I'm unable to kind of talk about it. But this is true that hypercoagulability has the platelets activated, which causes thrombosis, which causes so many of these serious situations with COVID-19. So apologies that I did not find more clarity for what they're trying to say. Continuing on, Honor UKB. Question, what do you think about vitamin oral sprays that bypass the digestive system like Better You, which I use? So there is a vitamin C or other vitamin that have oral sprays, and oral sprays are usually fine. They are faster for the absorption, number one, and number two, they can bypass the first pass metabolism. What does that mean? So let me just very quickly explain it. So what happens is when we have our GIT, so let's say this is the GIT. So this is the GIT. The food that enters the GIT would then end up in the GIT. From there, it is absorbed in the blood system. From the blood, all of these blood vessels would collect together and these will go to liver. So inside the liver would have a chance to look at all the metabolites that are coming in and kind of break them down or change them or modify them. That is what we call first pass metabolism. And many products that we take orally can actually become inactivated when they get to pass through the for the liver. Number one. Number two, so this is the first pass metabolism. Secondly, when we have the food that is present in the GIT, that food may take minutes to hours to be absorbed. So if you've taken something, it might take some time for it to become absorbed and available. So on the other hand, if we have the buccal cavity, the mouth, and the membrane of the mouth, and if we spray something on that, then what happens is that nutrient will become very quickly absorbed in the blood system and would have a chance to circulate in the body before going directly to the liver. So that first pass metabolism of the liver can be bypassed and the original form of the nutrient can become available to the rest of the blood system. Of course, the blood is eventually going to come back into the liver and the first pass metabolism is going to occur. But that nutrient would have a chance to go to the tissues of the body before becoming available to liver. So that is a good thing. Secondly, when we have something that we spray in the mouth, it becomes available very fast. It doesn't have to go through the whole GIT system and then become absorbed. So it can become absorbed within minutes and it can bypass the first pass metabolism. So after knowing this, if you said that, hey, just like Better You, if I take sprays, are they better? Of course, sprays will be better. So that is that question. Then we have Moore M. He has two questions. So there is another question. In the same video, boosting the innate arm of your immune system, you spoke about interferon gamma. I think it's not 8, it's gamma, and plant-based foods reducing it. Please explain this. So let me just very quickly show what I was talking about. So I have that video open somewhere here. No, I closed it. So let me explain what I was talking about. What I was talking about was that we were trying to figure out how to enhance and boost the innate arm, correct? One part of that is interferon gamma. Does anyone remember interferon gamma's action? So if I make it here, this is the, let's say, macrophage. A macrophage, remember that famous design that we make? Macrophage would present it to a T naive cell, the antigen that it has taken up. When I don't make eyes in these things, they look so not right to me. So these guys, and then we know that we go T helper 2 pathway or we go T helper 1 pathway, and then there are things here that happen, correct? Now what happens is when T helper 1 pathway is activated, then the T cells can produce interferon gamma. Interferon gamma. So I wrote it like this. This is gamma, not 8. So interferon gamma is produced that activates the innate arm. And innate arm produces interleukin 12 that activates the T helper 1 arm. So that is the basic, we call it interleukin 12 interferon gamma axis. That is the axis where they both enhance each other's function. So if we wanted to have more interferon gamma, that would cause the enhancement of the innate arm, then we could take foods that would do that. So plant-based foods can actually cause enhancement of interferon gamma, which can then cause innate arm to become strong. But it is also seen that too much of doing that can cause breast cancer. How does it do it? We do not know. But modulating too much of interferon gamma can end up causing cancers. So that is what I was saying, that do not modulate the interferon gamma in exceedingly greater amounts because it can cause cancers. So hopefully that answers that question. I'm going to go to the live side and see if there are questions here. Raza says, why is there a complete absence of runny nose action in COVID versus other respiratory viruses? Very good question. So of course, this would simply mean that the respiratory system here in the nose area is slightly better responding to the virus. So maybe the ACE2 receptors here in the nose are lesser, or maybe the immune system here is better, or maybe the IgA, which is present in the mucous membranes, that is working better here in the nasal area. But this is correct that the nasal secretions in the SARS-CoV-2 are lesser than other respiratory infections. For example, if we talk about rhinovirus, which is a normal common cold virus, 50% of the common cold symptoms are because of rhinovirus. That has that causes lots of nasal secretions and even tearing from the eye. So very good question, Raza. So then there is another question. Is the quantity of virus for infection still unknown? Viral load necessary? Question, is the quantity of virus for infection still unknown? So I think that we know that PCRs have been taking 100 copies of the viruses and saying it is positive or negative. But what is the exact amount of virus load which should cause the infection? Presence of the virus and replicating of it is infection. Causing the tissue damage and then the symptoms of it is disease. So when you talk about infections presence, then any amount of virus is infection. When you talk about COVID-19 disease itself, the symptoms, then that would depend upon a person's immune response and the viral load and the way the virus is increasing. So it would not be an initial viral load only that would determine what is going to happen. Of course, a lower viral load would cause lesser chances of the disease, but our immune response would also contribute. Our situation with our health would also contribute. Our nutritional status would contribute. Our exposure to other infections will contribute. So there are so many other factors that would work on it. So I heard that President Trump is on vitamin D, C, melatonin, a cholesterol drug, and famotidine. Merrick protocol. He's also taking aspirin. Maybe news people sure can't pronounce famotidine. So yes, so it seems like Merrick protocol with polyclonal antibodies as well. So what is your LH protocol? Which steroids you use? For my long hauler, so that was a question here as well that I was going to answer. So I'm going to answer it here. Zoltan Peto, if I am pronouncing your name correctly. So I use one, and that is Delta Cortrel, which is prednisolone. So I use prednisolone. Delta Cortrel is the commercial name for it. 5 milligram 3 times the first day, then 3 times the next day, then 5 milligram 2 times the next 2 days, and then 5 milligram 1 time for the next 2 days. And when you are tapering the dose, the first day is breakfast, lunch, and dinner. Second day is breakfast, lunch, and dinner. Third day is breakfast and lunch. Fourth is breakfast and lunch. And fifth day is breakfast only. So you give the dose in the early part of the day instead of the later part of the day. So that is my protocol. So far, that has been working very good. Okay, so and the news keep insisting, yeah, so of course, they are not medical folks. I think after someone has fought COVID-19 and the adaptive arm has been activated to recognize COVID-19, there is less chance that the person will be reinfected. That is true. So there's a question from Nebu. We had a patient with 70% saturation with no dyspnea, COVID positive. She's 80 years old. Chest X-ray clear. What do you think the mechanism? So 70% saturation with no dyspnea. That could be because she is her body does not need that much of oxygen. But no, I'll have to think about it. She's 80 years old. Chest X-ray is clear. Is her meter correct for the oxygen saturation? How did you measure the saturation? Maybe at that age and for her body habitus, maybe she is 70% is too low. So I'll have to think about it. Tell me more about her history. All right, so I'm going to go to the Twitter side for a second. How are you holding up? Are you doing okay? So I am, of course, just going to go through all of these questions. Question, can you discuss the latest changes in EVMS COVID protocol by Paul Marik? Yes, definitely. And the important thing is that when we had the discussion with Dr. Paul Marik the last time, please find that in my channel. I actually asked him what is the difference in his protocol before and after. So what I saw was the difference is, number one, he has become a little more stronger about the not using the hydroxychloroquine, one. And secondly, he said that post-COVID syndrome or long hauler syndrome, that is where he had more of the input. So if you see here, one, you would see that not recommended hydroxychloroquine. So this paragraph over here has become stronger. And secondly, he has the post-COVID syndrome. Salvage. And then monitoring post-ICU, hospital discharge. So let me just find it. Syndrome. This is the one. So this was the main, when I asked him this question, he said that this was the main change, that he has some thoughts about long haulers. And so that is what we discussed in that talk as well. So two basic things: he's become more strong about not using hydroxychloroquine, or actually saying don't use it. And secondly, this post-COVID syndrome. How long can we take daily quercetin, zinc, 50 milligram, vitamin C 1000 for prophylaxis? I would give it for as long as this pandemic does not go away. So quercetin is not harmful. Zinc is not harmful. Zinc does have its behavior with magnesium. So zinc can actually become less absorbed in the presence of magnesium. So you may have to separate them out. But zinc, quercetin, and vitamin C daily. It is important. Thank you for your recent video on home tests. You're welcome. I was wondering, after taking quercetin in EGCG and zinc, how long does it take for those to become available in the lung tissue? So the bioavailability for quercetin, for example, becomes 2 to 4 hours if it is the quercetin like phytosome, or if it is glycated quercetin, then it is 45 minutes or 1 hour. And as soon as it goes in the blood, it is going to start becoming available in the lung tissue as well. Same is true for zinc, and then for the EGCG. I remember we discussed this, that dexamethasone is contraindicated with ivermectin. This is a good question. Math Plus uses methylprednisolone, which acts more upon the lung and is okay with ivermectin. Dexamethasone is standard C19 protocol in South African hospitals, but neither ivermectin nor hydroxychloroquine is used, the latter specifically rejected. So in Ustangard, Drew. So basic question here is the dexamethasone's action with the quercetin, with ivermectin. So yes, so what happens is this. I think you would like this one. In our body, for the brain, so let's say this is the protective layer on the brain, and there are brain cells here as well, neurons. We have a protein here that prevents ivermectin from entering the brain cells. And what happens is that steroids, which, for example, dexamethasone, and methylprednisolone does the same as well. So it's not that methylprednisolone will not do it. The steroids can actually disable this protein, which would then allow the ivermectin to enter the neuron easily. So ivermectin, in the presence of steroids, will have better access to the blood-brain, to cross the blood-brain barrier compared to in the absence of the steroids. That is why it is said that in the presence of these steroids, ivermectin can cause brain damage or brain issues compared to somebody who's taking it without the steroids. And I have a study here as well. This one, dexamethasone. So there are two studies here. One says that when given with dexamethasone, ivermectin's absorption reduces and bioavailability reduces. Second study shows that this is actually Wikipedia here. And here, if you see here, since drugs that inhibit the enzyme CYP3A4 often also inhibit P-glycoprotein. So this protein that I talked about here is called P-glycoprotein. This protein, and that protein is usually going to resist the ivermectin from entering the brain, and this protein is disabled by all those drugs that would disable the CYP3A4 enzyme, and that would, steroids are included, and that would then cause ivermectin to go to the brain. And what are other such drugs that can do this? So if you see here, calcium channel blockers, which are taken for hypertension or cardiac failure, lidocaine, which is also a drug that is used, benzodiazepines, drugs used for various psychiatric needs, glucocorticoids such as dexamethasone, etc. So for these, all of them can cause this issue, not just the dexamethasone. So back here, hi dog, interaction between IVM and quercetin, so no interaction known. Also, is it true that dexamethasone makes IVM cross the blood barrier? Yes, that is correct. We just talked about it. And then I'm going to come here to the live questions and see if I can answer some things from here. So Logic has a question. Can you do a complete new video on your updated protocol for your patients and rationale, both preventative, acute, and supplements? Yes, I can do that. I was actually planning this week to put together the prophylaxis and the early treatment and the long hauler treatment, but there were a bunch of topics that became very important for me to do them, so I would do this. I was actually going to write up, so in an article, not just a video. So Margaret says, and Margaret, once again, thank you very much for your support. Mary Green Tea, for me, not happy about the ETO restriction due to the tick-borne illness. Got it. Yes, so James, that is very correct that in this EVMS protocol, Dr. Marek also added omega-3 for long haulers. Mary says, if vaccine is 70% effective, then does this mean that 30% of people who are vaccinated will not have immunity? Why is there any way to know who has no immunity? Mary, where did you have this number from? The vaccine should not be 70% effective. It should be more than that, close to 97 to 99%. In general, whenever immune system is being triggered, keep in mind that immune system, those folks who have poor immune system or who are immunosuppressed, their behavior will be different. So it really depends upon the kind of person's immune behavior, but generally 97 to 99% effectivity. So Logic says, Mary, I have also heard that vaccine may only be... No, so Logic and Mary, these are just the rumors. Ideally, what you should do is this: look at a specific vaccine's trial and to see then their data, that when we gave the vaccine to X number of people, how many people actually developed the antibodies. They would tell you exactly what is the effectivity of the vaccine. Then the phase 3 trial, which goes in tens of thousands of people's vaccination, that would really come back with the right numbers. And a vaccine that is only 50% useful or 70% useful, still it is useful, but it could cause more damage as well. For example, if I get the vaccine and I think I'm happy and I'm protected, and I'm actually not, and then I go out and I get infected, that would be a problem. And if 50% of the people are in that state, then that vaccine is a failed vaccine. So 50 to 70% is not an acceptable vaccine. Okay, so continuing on to the Twitter side, there is a question from Paula that let's talk about serotonin and 5-hydroxytryptamine. Paula, I would take up this topic and do a complete lecture instead of just here, because this is an important thing to discuss. Pezzo, so now Luffy knows that the talk is going on for longer. Pezzo Zoltan says, what is your current long hauler protocol? So I explained. So far, I did not have to add anything more. Just the this prednisolone has been very, very useful. So, excuse me. So maybe I have just lucked out, and my patients have lucked out that we have been successful with this. Lisa says, can we be sure over is over if this is healthy 19? So Lisa, about this, so there was a case report a few days ago in news that there was a healthy 19 years old who died. This is very similar to the case report I did about my friend's son who passed away as well. He was a 4th-year medical student. So Lisa is saying that what could be the reason, and can we do a case report on that? So I would do it. Then, dear sir, I mean to say prophylaxis does and frequency of these medicine per week. Debashish, I do not know the question. What do you think of these? So K-pop Super Strong says, what do you think of these most realistic futures that will happen in the winter? More lockdowns and waiting for vaccine distribution, manufacturing, scale up, quick, accurate tests and early treatments. Politics and conspiracy theories will hinder solving the pandemic. I think all of those are going to happen in various mixtures in various geographies, correct? In US, we are stuck in the politics. In many other countries, they are in the early treatment phases. In many other countries, they are in social distancing. Sweden is a very interesting example as well. So I think that the lockdowns are being lifted, and it may actually be that the lockdowns would just stay lifted now. The doctors have become a little more aware of how to help. People have become more aware of also how to be protected. We know the cocktails of things that need to be taken to keep us as safe as possible. So I think various countries would have various things. If I think about my country, US, I think we're going to keep getting stuck in the politics and conspiracy theories, unfortunately, because there are people whose interest is that this continues. Accurate tests and treatment, that is going to come in. My hope is that in October, November, we'll have vaccines. I think we're almost there. And then lockdowns and waiting for vaccine distribution and manufacturing. There would be some areas that would stay in lockdown. It depends upon the situation, but I generally think lockdowns will be lifted. What I worry for the winter is more spread because of other common cold-like illnesses, which would cause people to cough more, which would cause people to have more lower immune system strength and lower nutritional strength, and then becoming victim to SARS-CoV as well. Dibashi says, question for 2 October open forum, how to use bromhexine, vitamin K27 and thiamine in COVID-19 prophylaxis. So we're going to talk in detail tomorrow about bromhexine with Dr. Harrison. But bromhexine has been used, I think, 8 milligram per day, thrice a day. Vitamin K, take the on-label dose. And then thiamine, also take on-label dose. I do not think that we need high dose of thiamine at this time in prophylaxis. Can a baby statin of 5 milligram or 2.5 milligram be given to 74-year-old person? Look, I become very, very careful for youngsters and for advanced age. The reason is that I do not know their body's condition. So advanced age, I do not know the comorbidities. I do not know if their weight is correct. I do not know if their cardiovascular system is correct, if their renal system is correct. So for such situations, giving a general idea is actually going to be counterproductive. So I cannot say it unless you talk with your doctor, unless you have a health profile, and without a history, it is dangerous for me to talk about patients in this situation, especially when you know that statin can actually cause muscle deterioration as well. So I don't want to say about this. Alan says, we have discussed EGCG as a zinc ionophore and other benefits. If I want to start on this, am I better just drinking green tea or buying the supplements? Have a wonderful weekend, dear Maharaja of medicine and good health. Thank you very much, Alan. So the green tea drinking is fine and you should take it. However, a supplement has a predetermined quantity that you know that for sure I have taken this much. So either find that equivalent. For example, if you like to take more green tea, it is for taste and for that habit purpose, then just find the equivalent of a supplement to say how many cups of green tea that would have. Nowadays, I would actually go for the supplements because there are predetermined dosage present in there. So with this, I'll stop the screen sharing part and I'm going to come here and see. Jim says, don't you think if everyone gets their vitamin D3 levels up to 49, we won't have all the winter colds and flu? I actually believe it. If there was one thing that I would just ask everyone to do, that would be keep your vitamin D level 49 grams and above. Question, what do you think of the fact that Dr. Marek says patients get an organized pneumonia rather than ARDS? So Susan, organized pneumonia means, so if I go to my drawing board for a second, what happens is that, let's say if this is an alveolus, and in the alveolus, outside of this is the blood vessel, correct? And then between these two is just some tissue, very thin microscopic layer. This is our respiratory membrane here, correct? So now what happens is, when the inflammation starts, and let me take this off. When the inflammation starts, then what happens is that this area starts having more and more fluids that start coming out. Plus this area would start having fluids as well, the alveolus. Plus there would be the cells that are here. These cells are going to start getting broken down. The inflammatory cells that are present here, they are also going to start getting broken down. So the result of that is that over here, there will be a thin layer in the beginning of fluids. Then that layer would become more pus-like because it would have neutrophils and macrophages and other cells that are broken down, and the debris is present, even the virus itself, dead virus. And then finally, what would happen is there would be blood that would come in here as well. So that is the progression of pneumonia's severity. Finally, once that congestion has developed, that if there is lots of fluids that are developing, then we'll say this is ARDS, acute respiratory distress syndrome, that the patient is unable to breathe because of all this drowning in their own fluids in the lung. The outcome of this are two. The one outcome is called resolution. And in the resolution, what happens is that all of this pneumonia-like substance, this congestion here, is removed. So our macrophages would start eating up all of that dead debris. They would restore that area back towards normal as much as they can. Some healing would occur, some fibrosis would occur. So this is called resolution. And then another possibility is organization. Organization means that all of the congestion that is present here, the fluids and the debris and everything, that would just become fibrosed. So there will be fibrous tissue that would develop here. And now all of this has become forever a hard fibrous thing. And when this fibrosis would occur, then this part of the lung is not functional anymore. So that is what he was talking about. So, so JTJ says 69 nanogram per is pretty, yeah, so higher than, now take some selenium, that is good. Will diuretics help reduce lung fluids? So absolutely, Finn Freak, one of the solution for the ARDS is to give diuretics, but the problem is in COVID-19, there is a simultaneous reduction in blood pressure as well because of the sepsis setting in and the blood vessels dilating and the edema occurring in the body. So if you give fluids on top of that, that would reduce the blood volume even more and reduce the blood pressure even more, and then cause cardiovascular system damage, which can kill the patient as well. So the doctors have to be really careful when they're managing ARDS in case of COVID-19, other cases too, that how do we manage low blood pressure and congestion in the lungs with diuretics and oxygenation? How much oxygen should we give? How much diuretics can we give? How much blood volume can we afford to reduce without causing cardiovascular damage? Because if we give too much diuretics, then we'll move the damage from the lungs to cardiovascular system and renal system and cause further issues. Very complicated things to manage patients or humans. Barbara says, does black elderberry increase risk of cytokine storm once someone is infected? Okay to take it or stop? I don't think that black elderberry does that. So I can look up, but I have not seen black elderberry related to causing cytokine storm. Lynn says, is Zelenko protocol still viable? Yes. Excuse me. I actually believe that ivermectin is very important as well. So there can be an alternative protocol as well, that is with ivermectin, vitamin D, ivermectin, thiamine, melatonin, vitamin C, vitamin A, vitamin E, vitamin K2, magnesium, calcium, but ivermectin as a main player. I have seen that ivermectin with my patients had been very safe and has been a good player. People continue to say that hydroxychloroquine does not have after effects. I had one family, 5 members, all of them developing arrhythmias with hydroxychloroquine. It became an issue because the blood pressure would go down and up and the heart rate would go down and up so much that it was worrisome. So let's take a couple of more questions. So Xanax, so commonly used in increased risk of ivermectin. So Star Straight says Xanax, commonly used, increases risk of ivermectin. So correct. So as we just saw, it increases the risk of Ivermectin crossing the blood-brain barrier. Yes. Same for the calcium channel blockers as well. And Thea says UK isn't using either UK is not doing very good. They are not using them correct, but they are not doing great. So what happened to zinc? Efficacious or not, in combo with anything else, zinc is awesome. Zinc is awesome. It is efficacious. It should be taken with quercetin or some other, for example, EGCG. It should be taken with some ionophore, but it is great. It is important. Marie says, the vaccine may prevent disease but not infection. That could mean that the vaccinated person becomes asymptomatic if infected, but could have undetected injuries nevertheless. No. So, Marie, what happens is this. I'm going to answer this question by drawing. So, here, let's say this is our body tissue. Here we have antibodies, B cells ready to make antibodies against the virus. They're just sitting there. They have their hands open, trying to detect the virus. And they're saying, okay, virus, if you're here, I'm going to attack you. Now, infection simply means virus's arrival in our body. So, of course, we cannot stop virus's arrival other than social distances and other than masks and so on. But imagine that the virus has arrived in our body. So that is infection. Now, as soon as the virus arrives in the body, if we are vaccinated, then what happens is that mucous membranes have IgA in them. So imagine if this is mucous membranes. I've just simplified our body into a box. And the box has outside, it has this mucous membrane. So these are the wet surfaces of our mouth and nose and eyes and vagina and anal canal and urinary system. So these are all mucous membranes. So when the virus arrives there, we have IgA antibodies already sitting there to catch the virus. If, let's say, virus still continues to proceed further and infect some cell, that cell is going to present the virus on its surface as an antigen presentation. If it is an professional immune cell, then it is going to present it on MHC2 molecule. And if it is a normal health cell, then it is going to present it on MHC1 molecule. So once the cell presents the virus, then the B cells that were now trained already, these B cells are so that pathway of immune system, the naive cell would come connect, and then that would become T helper 2, and then that would cause the B cells to become activated. Here we have memory B cells as well. So these B cells are going to become activated and very quickly produce antibodies. These antibodies are going to go surround the viruses and attach with them. So because of that, there is no tissue damage. However, what can happen if you're looking for what could a vaccine do? Of course, there are antibodies now present and they are attached with the virus. These antibodies can then settle on various tissues and cause local inflammations. So because of antibody, there can be inflammation. There can be antibody-dependent enhancement as well, that the virus attached with the antibody might get phagocytosed in the macrophages, dendritic cells, and it can cause infection in them. But that is the point of doing all the trials to see what kind of issues would appear with vaccine. And then we only say the vaccine that is good will be that has passed all these kind of milestones. So I think this is it for today. So there is a question here that Debbie says that wasn't the old lady with 7% oxygenation and no shortness of breath a happy hypoxic victim? Correct. Happy hypoxia is a possibility, but normally happy hypoxia means that a person is hypoxic, but they're still not aware of it. Usually it's not as low as 70%, because at this level, we would start having organ damage. So happy hypoxia is a little higher hypoxic stage. Maybe that is what happened here. I need to hear more about her history and her body and comorbidities. Dip says, question, certain vaccines amplify NK cells, some amplify T helper 2 responses, while some work through T helper 1. I wish to understand what is the mechanism of rhinitis with respect to T helper 1 to innate. What is the mechanism of rhinitis? So you started the question with the immune system amplifications of various arms. Rhinitis is simply inflammation in the nose. So Dip, I don't understand the question. Maybe put that question back again, and I would answer that next time. Cool. So this is what we have today. Thank you very much for staying with me for such a long time. Anyone? So Dip says that I get breathing problems. So Dip, that may be because of your mast cell degranulations or other reasons. I cannot, from just from vaccinations and from innate arm or the other arms amplification, I cannot really tell what is happening with you. So once again, I need to understand your history, and I need to understand your body's response, and then do some labs to understand what's going on. Scruffy Scrubs, thank you very much. I love the pet. Margaret, thank you very much once again, and thank you for everything you've done. James Kelly, thank you very much. Gupta, thank you very much. Lynn, you're very welcome. Tell everyone about your Black Friday special. So we have, if you would like to buy a Dr. Bean subscription, then we have a sale going on at this time. So please tell me if you need it, and I would send you the link, or I'll direct you to the link. So with this, thank you very much for today. Please like, subscribe, and share. And if you would like to support the work that we are doing, then the link for the donation is in the description. I would see you on Monday. Tomorrow is my off, and stay safe and protected, everyone. I would see you on Monday.